Hi, I'm Dr. Jeffrey Antimarino from Bellissimo Plastic Surgery and Medi Spa. Welcome to Facebook Live with us tonight. Tonight we're going to be talking about all of the anti-aging non-surgical treatments that you can do. Now we're coming into the holiday season. Sometimes we don't want the downtime of a surgical procedure. So we're going to talk about 4 of the main things that we do, mainly Botox, the dermal fillers. I think we're going to be talking mostly about Juvederm. We're also going to talk about our Vivace device, and if you didn't see our Facebook Live on that, you'll want to hear about it tonight. And lastly, we're going to be talking about our DEKA CO2 Laser. Tonight we're also going to have Pamela doing a demonstration on Eve, who was kind enough to let us do some Botox on her. So if anybody has not seen Botox and is wondering if it's painful or anything else, stay close to us tonight and you'll see it in just a few minutes. So I think we'll just kick off tonight and talk about all the things that you might want to talk about or hear about that are non-surgical.
Why do you believe patients are deciding to get more non-surgical anti-aging procedures versus surgical?
I think the biggest part is I think people now are trying to do anti-aging preventatively or at an earlier time frame than we were maybe 10 or 15 years ago. So I think there's been some improvements in the devices. A couple of devices I'm going to show you tonight that have had some good improvements over the years. Botox has been pretty steady, and so are the dermal fillers. So I think that patients are now, with all the advent of really getting on things earlier, patients in their late 20s and 30s are doing a lot of skin care, trying to do the anti-aging. I think we've done a lot of teaching on the importance of sunscreen, and also that as being an anti-aging device. So I think as the nation goes with the education of all of the things that you can do, I think a lot of people are jumping on board now so that they think they want to maybe put off some of the surgical treatments for later on.
Is there a benefit of, besides the obvious of less downtime, going with a non-surgical versus surgical?
Well, as I said, sometimes patients are coming in and they're in their early 30s or mid 30s, and so there really isn't maybe some surgical treatments for them that really at that time. And at that point, the non-surgical is actually a better choice for them. And the nice thing about that, as you said, there's really little downtime to no downtime. Most of it is maybe some minor swelling, really not much pain involved. So sort of the bad part about that is most of those need to be repeated at some point. With the surgical treatments give you a little bit more longevity in how long they last. But what we're seeing patients coming in at a younger age, and so I think for them surgery isn't really an option. Now patients, as you start moving into your 40s, mid 40s, late 40s, early 50s, then surgery becomes sort of more of a prominent choice for you or an option for you. But what we're finding is that the non-surgical devices or treatment plans are actually as an adjunct to surgery. And when I talk about our CO2 laser, that's really the reason I bought it, is an adjunct to what I do surgically. So as we move forward, we have found over the years that sort of marrying the surgical and non-surgical treatments actually gives you a better outcome and a better long-lasting result than just a surgical procedure by itself.
Do you offer a consultation to help someone decide which non-surgical treatment is best for them?
Yeah, absolutely, because it's the same thing as a surgical treatment. What your goals are the most important things, and so either myself or Pamela, Ashley is our other injector, and Tara is our esthetician, and I think everybody that has met them at some point, your goals and what you're really trying to go after, then we can sort of, knowing what we offer, knowing what we can do for you, then we can kind of get a game plan together, whether it's skincare and Botox. Maybe you need our Vivace to try to tone up some of the dermis. There's other things, maybe you need peels. Some patients want to do dermaplaning. So I think we can put together a pretty comprehensive treatment plan for everybody, but that's important to meet with somebody who's the expert to help you get through that.
Or sometimes they meet with all of us.
Mm-hmm.
They may start with him, come into my room because they may not want to do something so invasive, And then I conjunct with Tara to talk about skincare and make sure we're all on the same page, that we're giving them the best options.
Right, I think that's the nice thing about having us all here together when we're seeing patients, that we can all kind of collaborate and get the patients their best results.
So let's talk about Botox.
Go ahead and hit it.
We have Eve with us today. She did have Botox approximately 1 year ago, and she's interested again. The things that bother her is her lines on her forehead and some fine lines around the eyes. So today we're going to do her glabella muscle, we're going to do her frontalis muscle, and her periocular muscles. So she wants a softer look, younger and fresher, with a little bit of movement. She doesn't want to be frozen. She just wants a soft, natural look. So that's what we're going to do for her today. And then she'll see her results. It starts working today. She just won't see the results for 7 to 10 days. It'll start kicking in 2 full weeks to see the end result. So we took some before pictures, and she's going to get some after pictures in 2 weeks. So we can post those and compare her results for her. So I'm just going to, if there's some more questions, we can talk while I'm getting her prepped.
How long does Botox last?
On average, Botox lasts about 3 to 4 months. It's a little bit different for everybody. So we find that patients that have a higher metabolism or exercise frequently are kind of metabolized a little bit sooner, so they're more around the 3-month mark. Other patients can last about 4 months.
And do you want to talk about what Botox does, how it works?
I think people still have an idea, there's still an idea out there that Botox is, because comes from botulinum toxin, I think people still think it's a poison, and they're afraid that, using a poison in their body. Botox does not do any damage to a nerve or to a muscle. Basically what happens is, as Pam starts to inject here, you can watch Eve's face to see that there really isn't too much pain involved with it, and there's been no numbing cream, no any type of lidocaine or anything in the injection itself. So this is just straight Botox. But basically what happens is, when your brain signals the muscle in your forehead, the frontalis muscle, to raise your eyebrows, as I'm doing now, what happens is it sends a message down through the nerve, and at the end of the nerve is a neurotransmitter called acetylcholine. And acetylcholine now is released by the nerve, and it binds to certain receptors in the muscle. Botox looks very similar to acetylcholine in a 3-dimensional structure. So, in other words, Botox can mimic an acetylcholine molecule, and it binds to those receptors on the muscle. Now, when your brain tells Eve's frontalis muscle to lift her eyebrows, and acetylcholine is now looking for receptors on the muscle, there's none or very little to be seen, because the Botox is bound to those receptors. Since the acetylcholine doesn't bind very strongly or at all, there's no movement. And so eventually the Botox is just dissolved by your body and goes away, and the receptors have not been changed. So you'll regain function in 3 to 4 months.
Is there a difference for men and women getting Botox done?
I think that the amount that you need is probably a little bit different. Men have a little bit stronger muscle pool. Sometimes we can develop deeper lines in the face because our skin is thicker. So, Pam, I think you can comment on that better than I can.
Yeah, sometimes they require a little bit more. And also in the glabella muscle here, theirs are a little different. They make a higher V, where a woman's makes like a wider V, I guess that you would say. So its placement's just a little bit different. But making them emanate and make their facial expressions shows you that muscle structure. So that's what's important, that you're capturing the muscle that you're trying to inject.
Who's a good candidate for Botox?
Really, anybody. We usually tell people above 18. We don't like to do anybody below that.
Right.
But if somebody has lines, and I've seen younger people have lines, and they're bothered by them. So really anybody.
Mm-hmm.
I do people in their 80s. Like, if that's
Right.
what they want, it works for them.
Right.
Softens up the lines.
I think that if you're starting to develop lines, I've never been one to be a proponent for prophylactic Botox. So if you don't have lines, I don't see any reason in treating it, because if you don't have them, there's no reason to try to prevent something from not being there. once you start developing lines, Botox does so well that the lines will actually just go away. So I would say when you start to develop lines, let us see you and evaluate you, and we can start treating you at that point.
Eve, how are you feeling?
Fine. It doesn't hurt at all.
Yeah, the injections actually go pretty fast, and the
Very.
needle's so small, you really don't feel it.
Mm-mm.
What now? People a lot of times get Juvederm confused with Botox or
Mhm.
fillers confused with Botox. What is a filler? What's the difference?
Yeah.
Usually I explain that the area from here up is usually a neurotoxin area, and usually here down is a filler issue. Because what happens as we age, we lose bone structure, we lose fat pads, and things come forward. That's why everybody sees, lines in the marionette lines, or their lips, they get wrinkles around their lips, or they get jowls, and that's all from muscle loss or fat pad loss, and that's what we see. Our skin loses elasticity. So the goal is always to put volume back where you're losing it, to add a little volume sometimes to the lips. If somebody gets fine lines around the lips, we have a product that can go in there without creating a thickness of the lip. So that's usually the goal that I tell people, just so they understand. Neurotoxin goes from here up, so that'd be the periocular, the forehead, and around the eyes. Crow's feet, other words, and then the forehead. And here down is usually a filler. You don't really put filler up there anywhere.
Liz asked, does Botox help the light wrinkles by the side of the lips?
I've put a little Botox in the upper lip for some fine lines. It does not last long there. You can put it in there, it's gonna last you maybe 30 days. You move this muscle so much that it wears it off very quickly. I have some people that do it every 30 days. They don't want to put filler in there, they want to soften their lines, and actually I've seen it work. So now she's at the point that she comes every 2 months, because it's really softened them to the point that she doesn't have to come every month. So it can, but it's not going to last long there.
I've seen where you get an injection around the lips and you don't realize what that muscle does. So kissing, drinking out of a straw, things like that.
I always tell people it's just a caution when you do anywhere in the lip or around the lip. Things you can't do is whistle or drink from a straw when you mouthwash. Any of those things, you got to be real cautious, because it's not going to be pretty.
Right, and the key thing about that is you have to be careful with whoever's injecting, that they understand that as well, because that muscle around your mouth is a circular muscle, and so if you put in too much Botox trying to treat those lines, what ends up happening is you weaken that muscle temporarily again. So now you have problems even with speech, even you forming P's. So you have to think about all the things that you're doing with your mouth. So when you do that, you be very cautious and use small amounts. So you want to soften the lines around the mouth, but you're not going to cure them. And the amount of Botox it would take would completely, change that muscle tone, so that you won't be able to speak well, and certainly drinking and keeping things in your mouth will be much more difficult.
Kelly wants to know, is Botox or Juvederm better for the lines in between your eyebrows?
So I would use Botox there. I'm thinking she means the 11s. Now, if somebody has a deep line in there, and after doing Botox, you relax that muscle and they still have a crevice there, I use a super thin filler, Volbella, just to kind of lightly put a little bit in there to fill in the space. But you want to relax the muscle first. That's the main thing, because that muscle contracting is what is making those lines. So you want to make that nice and smooth. And then if after, your Botox is totally kicked in, it's been after 2 weeks and they still have indentation there, I just put a little bit of Volbella in there to fill in the space.
Now, some of the new technology, like with the lasers, will also help, as you'll talk about later, for lines around the mouth.
Exactly, or any lines on the face, like fine lines around the face, and we'll talk about that in a little bit, about what those treatments are like as well, and what those devices, what their goal is compared to dermal fillers. Trying to think of it this way, is any line that is caused because of muscle movement, so raising, squinting down around, any of those lines are caused by muscle. So the Botox or the neurotoxins, as Pamela was talking about, will soften those lines. The lines around your mouth, the deepening of the folds, the marionette lines, those lines are due strictly to aging and loss of volume, as Pamela was saying, loss of fat volume in your cheeks and things are sliding forward. The dermal fillers replace volume, but they do nothing to soften the muscle pool. So that's the way you kind of have to start kind of think about it when you're talking about the difference between a dermal filler and a neurotoxin.
Now, Pam, one of the injections you do with Voluma in the cheeks can actually soften some of the lines in other places, correct?
Yes. So when someone comes in and wants an evaluation, and they'll start telling me what areas bother them. So the first thing I look at, I go back to the mid-face, because the mid-face is usually where you're seeing most of the volume loss. They may be complaining about a jowl, they may be complaining about a marionette line, anywhere in here. But if you would go back up and pull up on the cheek area.
Turn your face, Eve.
This
There
way?
you go.
Is that better?
That's okay.
Yeah, if we pull this way and you correct, sometimes you can correct a lot of the lines there. You can correct the jowl line. And so the first thing you want to do is replace the volume back where the client's losing the volume. So that keeps them looking like themselves. You're not changing their look. That is not the goal. The goal is to keeping them looking younger and fresher, and that's what they want. So you can correct a jowl that way, you can correct a marionette line, and then you go back and reevaluate that. Did we make the corrections that they wanted to see? But that's where I always come back to the mid-face and evaluate that.
How long does Juvederm typically last, or is it vary depending on the product?
There's different Juvederm products. So the deeper, thicker product is Voluma, and that has a lifespan of approximately 2 years. Then in the marionette lines, usually like here down, this is a Juvederm area, and the lips, marionette lines, Juvederm is approximately 8 months. The Volbella, which is the super, super thin, that just goes in the lip line or in the fine lines, and that is usually 6 months around the mouth, because you move that muscle a little bit more. It's thin, goes superficial, and we just move that a little bit more, that it doesn't last that long.
Can you do fillers and Botox in conjunction with a laser or something else?
Usually no. We tell them because of a neurotoxin, like hers is starting to work now, but she doesn't see the results now. She's not going to see things start happening for 7 to 10 days, and then it's going to be 2 full weeks till she sees the end result. A filler you do see instantly, but we always tell them to give it a little bit of time before you would do a laser treatment on top of it. We don't want the product to move. So a laser, we would say wait 2 weeks.
Okay, we have a question from Paulette. She's asking, how much is this? Right now we have a holiday special starting December 1st, and that is Botox for $11
a unit instead of $13 a unit. Now everybody needs to be evaluated to see how many units you would need. I can just kind of go over on Eve a little bit what I did. In her glabella muscle here, I did 20 units. Across the frontalis muscle, I did 10 units. And I did 6 units here, and I'm going to do 6 on her other side. I'm not going to let her one-sided. But everybody's a little bit different. So it's in that evaluation, we decide how many units.
Okay, thank you, Paulette, for your question. And if you are using filler and you really don't like the result, is there anything you can do to take it out or dissolve it?
We carry all hyaluronic acid fillers, which are reversible. With a product. We don't want to do that, so we don't recommend that you get too much product to the point that you don't like it. But we go over all that in the evaluation, so you know that there is something. If you're scared of it or worried about it, it is reversible.
Right. Okay. That's why we try to be very conservative at first, and the nice thing about doing dermal fillers, the patient's awake, and they can actually watch as you're doing it and kind of control the situation. A lot of patients will ask me why can't I do a dermal filler while they're under if I'm doing a facelift or something, and I don't like to do it that way. Number one, I don't have the experience that Pamela has, so I don't want to be the one doing it. But realistically, the patient is asleep, and they really can't guide me as to how much filler they want or what looks good to them. So that's the thing that when we talk about, as you pointed out on Eve, you want to make sure you sort of reestablish the balance of the patient's face and not overcorrect. And so you can always add more filler. So it's better to just go slowly, especially if it's somebody for the first time. You want to be conservative. You want to learn what works well for them. Not everybody needs 20 units and 10 units or 2 syringes or 1 syringe. Depends on that patient's need and what their goals are.
Let's talk a little bit about Vivace and Tetra.
Great. Two treatments that I love. So Vivace is, in fact, I think what we'll do is I'll swap places with Pamela so she can come over and give symmetry over here to Eve, and we're full service here.
So tell us about the Vivace device.
The Vivace device, we don't have at this office right now. We move it back and forth between the 2 offices. But basically, Vivace is, everybody knows about microneedling. It's been a treatment for a number of years now. It's basically some very tiny, fine needles that are used to actually make just micro channels in the skin. So you basically stamp it or roll it, depending upon the technique that you have. And it causes micro damage, again, not only to the epidermis, the outer part of the skin, but to the dermis itself underneath. It causes the body to now repair the dermis. So the goal is as we get older and the dermis is thinning out, that's when we see more aging, we see more lines appearing. So the elastic properties of the dermis are so important. When you damage it in just such small ways and your body can repair it, it produces more collagen, therefore your skin becomes thicker over time. We have the microneedling here. It works great on scars. It can work on pore size, texture. So the Vivace device is actually one step up. So Vivace is a combination of radio frequency to the microneedling. So on that device, you have those same tiny needles, but at the last 2 millimeters at the bottom, it is plated with gold. The radio frequency now current passes through those needles, and only at those last 2 millimeters is it emitted. So as you come through into the dermis and you cause those micro fractures, now that radio frequency is penetrated into the dermis. The radio frequency adds a little bit of heat, so now you have heating of the dermis, and that causes more collagen production as it heals. So the Vivace is a really nice way of sort of stimulating that dermis to replump, regain some of that youthful skin that we all want as we get older, especially for ladies, because ladies' skin is thinner throughout your life, but after all the hormones, the estrogen and progesterone, after the age of 35, that skin really starts to thin out, especially on the face. So you can use the Vivace to help restore that. The nice thing about Vivace is you can use it anywhere on the body. So we have some patients doing it onto the neck, the upper chest wall, even on the back of the hands. What we do is we put on some topical numbing agent for about 20 minutes, and then it's very comfortable after that. Downtime is about a couple of hours of being slightly pink, but you can go back to work and go back to exercising later that day. So it's very little downtime. It stimulates collagen for about 6 weeks at a time. So the recommendation is to do 3 treatments about 6 weeks apart, and then you'll see sort of this gradual increase in your thickness of your skin. But what a lot of patients will see is the luster of their skin is improved, especially by the end of that 3rd treatment.
We have a patient, Paulette, is asking, is this good on acne marks?
It is actually, and so it can actually work even on some active acne. There are some different lights that you can do, and so to treat bacteria of the skin, and also an anti-aging light that's associated with it. So we've had great luck with it with acne scarring, and so again, it works on the same premise of the microneedling, but with the radio frequency, you actually get just a better boost of the correction. So you can use it on both. You can also use it on all skin types, which is nice as well.
Do you want to share with us a little about the Tetra?
The Tetra is my latest device. We did a Facebook Live on the Tetra a couple of months ago. But as I said before, I bought this machine because I needed an adjunct to what I do in the surgical realm. When you do facial rejuvenation, we're able to restore the anatomy of the face and help plump the cheeks again, restore all of that fullness that has kind of slid forward over the years of aging. We can also take off the extra skin. The problem is that we don't treat the skin at all. And so the texture still becomes an issue. The lines around the mouth still become an issue. The fine lines in the skin itself still become an issue. They're softened with the facelift or neck lift procedure, but they're still present. Even with eyelid surgery, you can still have some crepey skin on the lower part of the eyelid. So as an adjunct, when patients are going through those rejuvenation surgeries, what they find afterwards is they look much more, youthful, much more rejuvenated. However, some of those things that really bother them are still present. And this device I bought because it really hits hard in those areas under the eyes, around the mouth, really trying to take care of those small lines that everybody or every woman hates. Men don't get them as often as women. So this device is really nice because it does three things. There is the lower level of it is called the CoolPeel. Then there's the middle level, which is the DEKA Pulse, and then lastly, it's actually a cutting device, so I can actually operate with this device. So the CoolPeel is lower energy, and it stimulates, almost like the Vivace, it'll stimulate collagen in the dermis of the skin for 6 weeks. It also treats the outer part of the skin. So if anybody's had a traditional CO2 laser from years ago, the problem with that is it actually took off the outer layer of skin, and now you had these open wounds or seeping wounds for several weeks. This is a partially ablative CO2 laser. So just as the microneedling caused micro channels through the skin, this does it as well. So the laser actually penetrates in small beams through the skin, so it targets water in the epidermal skin, so it ablates that. So as you stamp it, and there's a Facebook Live that we had, and it actually shows the skin turn white. All those little areas that were hit by the beam turn white because it basically explodes that cell. It penetrates deeper into the dermis and again causes stimulation of the dermis so that the dermis will plump and become thicker over time. So as the CoolPeel goes, you want to do that every 6 weeks for 3 treatments, the same as the Vivace. And what we've started really doing is marrying the Vivace and the CoolPeel together, and we've seen some really nice results with that. So a patient would go into Tara's room and do the Vivace treatment. It takes about 45 minutes. Then it would come immediately into my room where I would do a CoolPeel on them, and that takes about 20 minutes. So really no pain involved. The downtime is about 2 days of redness. We would suggest that you go home, not go back to work that day, spend the rest of the afternoon kind of resting, and then in about 2 to 3 days that redness is really gone. So you'll start to see it really for the first couple of days. It fades, and by the 3rd day you actually can wear makeup and go back to doing whatever you're doing. So it's very little downtime. Some patients take the next day off of work and enter back to work when you put those two together. There are several strengths of the CoolPeel, so depending upon what you really need to treat, so sometimes deeper lines, what I usually start them is on a low setting at first, as we talked about, being very conservative. Start the first setting low, see how they react, see how much downtime they have. The next time they come back, depending upon what they tell me, what results they have, I can change the settings on this machine. The nice thing about this machine is very versatile. I can either go up on energy, I can go up on spacing, into concentration of the beams. We can do different things with it depending upon what I want to accomplish. So the next phase, we can change those settings accordingly. And there's even another setting after that. So marrying either by itself or marrying it to the Vivace is a really nice way of really toning up the skin, changing the texture. What you'll find is after 3 to 4 days after this, you start to just have this light flaking off the skin. The skin becomes very smooth. The pores are much smaller. Your skin just looks really rejuvenated much quicker than just the Vivace alone. But the CoolPeel really hits it on top, sort of a boost to that. The second part of it is the DEKA Pulse. That was the reason I was really interested in this machine. To me, the CoolPeel was a bonus. Going around the DEKA Pulse is a much heavier concentration of the laser. It again attacks the water in the cells and the water in between the collagen fibers. So it's much deeper, much more energy, and so when you do that, you really concentrate that around the mouth and around the eyes. You can do the whole face if you want to, and I've done that on a couple of patients. The reward is much more because you really are going to soften those lines. The DEKA pulse level stimulates collagen for about 6 months. So at that time, we would reevaluate if you needed another treatment or you can just go until the next year. But the DEKA pulse, the downtime is about a week to 7 to 8 days. You have some mild swelling and you're pretty red. Again, the nice thing is there's no open wounds. There's nothing that you have to treat. You basically look like you have a good sunburn for about a week, and so you feel kind of warm, especially that first night. Mild swelling for the first couple of days, that goes away pretty fast, and then after that, it's just basically staying out of the sun for 2 to 3 weeks, so using a lot of sunscreen. But the DEKA pulse is really adjunct for what I do in the operating room. You can actually take this into the operating room and do it while you're doing a facelift, and some surgeons are doing that. I prefer to do the facelift, allow that to heal, and then move on about a month or 2 after the facelift is to hit them with the DEKA pulse. So that's the machine. I really love this machine. I'm getting very good results with it. And lastly, like I said, the other part of it that we're starting to move into now is to actually be able to operate with it, and we're going to start removing lesions with it probably by the start of the new year.
Can you use that on both male and female?
Yes, you can use this on all skin types because it focuses on, its target is water. So it doesn't matter if you have a tan, you're darker skinned, lighter skinned, it goes after the water. You can do it through a beard, you're not going to get any facial loss. If you have, for a lot of women that have melasma or color changes due to hormones, it's not going to treat that. That's our aerolase laser. That wavelength kind of focuses on more browns and pigments and reds and things like that. But so this laser is safe to use, and you can use it down onto the neck, the top of the chest called the décolleté area. You can treat age spots on the back of the hand. So this really treats a lot of skin lesions as well. And so what we start to see as we get older, those little brown or black sort of things that we think that a lot of patients think are moles or even melanoma, those are seborrheic keratoses. You can actually ablate those with this laser. So I hope we answered all of your questions tonight. You can see I get pretty excited over my new friend here. I've been waiting a long time and I finally found the one I think that is going to work well. Plus it's Italian made, which I really love. So I hope to see everybody next month. I'm not sure what our topic will be yet, but it will be in the Christmas season. So I want to wish everybody a very happy Thanksgiving, and hope the food is fantastic and it's a safe holiday for everybody because a lot of people will be traveling. So we will see you next month.